Time of the year, most of us are thinking about our New Year's resolutions.
Many East Texans start thinking about weight loss, getting in shape. East Texas Medical Center's Olympic Center Director Jeramie Hinojosa joins us in the living room to talk more about that. Nice to have you with us, by the way. You know, every doctor we have in the living room, and there are quite a few, it's like a mantra with these guys: diet and exercise, diet and exercise when it comes to staying in shape and losing weight. Really, exercise is practically a medicine, I guess, the way you guys are preaching it. Is that right?
It really is. What we find, research shows that exercise is clinically proven to treat and prevent over 40 major chronic diseases, everything from obesity, heart disease, hypertension, diabetes, and cancer. And it needs to be viewed as such, as a preventive type of medicine. So that's what we're trying to do with the whole exercise as medicine movement. What we find that there's a dose-response relationship as well, just like any other type of medicine, if you will, that just a little bit of exercise has an enormous impact on the risk reduction for an individual's capability to develop heart disease or other chronic diseases. In addition, there's a marked difference in those that start an exercise program, physical activity levels and physical fitness, with an increase in not just improvement in quality of life, but lifespan and reduction in mortality rates. So people that exercise live longer, and along with that dose-response relationship, the more you exercise, there continues to be an increased benefit for those with improved physical fitness levels and increased activity levels. So that's, in essence, exercise truly is medicine.
Oh yeah, for sure. Now, doctor, does this message have anything to do with the healthcare reform?
It does. You know, when we're talking about a lot of the changes with healthcare reform, we're looking at, we hear the word accountability, accountable care organizations, and that has to do with people becoming accountable for their own health. What we find is that 40% of your health status has to do with your behavior, your personal decisions. In addition, with healthcare reform, physicians are going to become incentivized to keep patients healthy. They're going to be looking for assistance in keeping their patients healthy and not just giving them pills and sending them for tests and things like that. How can we benefit their patients? How can we help their patients stay healthy? Because they don't want to be dealing with these people over and over. No. They want to move on to the really sick people, and exercise is the key.
Preventative maintenance is always a good thing.
That's right.
How's East Texas Medical Center? How are you guys promoting this? How are you getting the word out on this?
Well, we're really focusing right now. We've got a project going. We've done a pilot study with. But first of all, we really encourage people to talk to their physician about physical activity. And we really, the main point of the exercise as medicine movement is to get physicians to start using physical activity as a vital sign. So you come in, you see your doctor, and you get your heart rate checked, your blood pressure, your weight, and you get all this feedback. Well, physical activity needs to be a vital sign too. How much are you exercising? It's a couple of simple questions: how often and how much? And if it's not meeting a minimum threshold, they should immediately be referred for a physical activity program. And what we've done over the past year is piloted what we call an exercise as medicine referral program, where a physician can easily refer a patient to a supervised program that's free at the Olympic Center. As long as they're referred by their physician, they get a free fitness assessment from a professional credentialed fitness staff member, and they get a 2-week free pass to the Olympic Center along with an exercise prescription. We can send them home with a home exercise program. There's no barriers there. You know, when you come in and see your doctor, and if you're unhealthy and you're not thinking about starting an exercise program. So if the doctor tells you, hey, you need to start an exercise program,
get out and move. Yeah.
Immediately it's, oh, well, all we're asking for is your time. There's no financial barrier there. It's a free program. Just give us your time, let us educate you, set you up with a program, give you some baseline measurements, physical fitness, and we can help you be successful and help the physicians and help us all save money through healthcare.
You will see the results. That's true. Exercising affects your mind and everything else. Fights depression. It's a wonderful thing.
Absolutely.
Jeramie Hinojosa, East Texas Medical Center Olympic Center Director. Nice to have you here.
Thanks so much.
Have a Merry Christmas if we don't see you.
You too.
Okay.
You too.
For East Texas